kuja kutembea kuona pale tuko. This is a referral hospital for the bigger Tharaka constituency and the environment. Like you've heard, we treat cases from Kitui County, we treat from Meru County or the neighboring, because medical services no boundaries at all. Patient is a patient. It does not matter where they're coming from. As far as they are human beings, we will give service with humanity. Here in the hospital, tumetembea several departments of MCS na umeona vile tunakaa. Kwanza kabisa nataka kupongeza staff wetu, because this hospital is very very clean. I've also looked at the patients and nimeona patients ni watu ambao wamefurahi. You can tell patients who are not happy by just looking at them without even talking to them, but they look happy. It means they're getting good service. Maombi yetu ni kwamba muendelee hivyo hivyo, even give better services. We have two issues that we have looked at, or what really was our area of interest. Kwanza kabisa tulikuwa tunataka kuona zile equipment ziko hapa ambaye zinasaidia wananchi. Sana sana kuna equipment zile za tunaita mess equipment, zile tulipatiwa in partnership with the national government. CS alikuwa na interest kuona kama zinafanya kazi, atatuambia kama vile ameona. Lakini kulingana vile ameona madam, ni kwamba we don't have all the equipment here, kwa sababu as much as we have the x-ray, digital x-ray machine that are working, we have good theater machines. Tukihitaji picha ambayo inataka scanning kama CT scan, mpaka tuende mpaka Chuka ama tuende pali kama Meru. So katika hiyo mula ya miaka 5, we would like to be the first one queuing, requesting for a CT scan, and I hope your office is on first come first served. So we are one among the first ones. Tukipewa CT scan katika Marimanti hospital tutafurahi sana, so that we don't have to wait for images to come from Chuka hospital. Ya pili, tumeona kwamba kuna upungufu wa madaktari, na sio hapa aswa peke yake, iko upungufu wa madaktari hata Kenya mzima. Na hii upungufu ya madaktari it is very ironical, kwa sababu iko madaktari wengi sana ambao wako nje hawana kazi, lakini hapa hospitali kuna upungufu. Ni kumaanisha iko shida kidogo, because they are out there but we can't be able to afford them. Na the situation is so dire, mpaka doctors are feeling frustrated, and some of them are even committing suicide. Very young doctors, we're losing very young people. Na kama counties lazima tutafute namna, tukijadiliana na Ministry of Health, vile tunaweza kuhakikisha kwamba we'll absorb more doctors in our hospitals to give this service. Na hii absorption definitely lazima tuhakikishe kwamba kuna resources. Na ndio tumesema kama serikali za counties, we must improve on how we manage our revenue. Na one of the things we are asking all counties to do, na sisi kama Tharaka Nithi tutaendelea kuhakikisha hiyo itafanyika, is to ring fence the funds zile zinapatikana kutoka referrals, na zile zitapatikana kama treatment fee hapa hospitali. Saa hii hiyo pesa huwa tunaweka kwa exchequer, inarudi mpaka Nairobi kwa CRF account, inaungana na ile nyingine imeokotwa kutoka kwa soko, inaungana na ile nyingine imeokotwa kwa mchanga, imeungana na nyingine imeokotwa huko kwa barabara, na wakati inarudishwa hakunanga hakikisho kwamba zote zitaenda, zile za zitoke hospitali zitaenda hospitali. Kuna uwezekano mama anakuja analipa pesa hapa ya kutibiwa, na badala ya kuimprove ile facility ambayo anatibiwa, inarudi inaenda kutengeza barabara, inarudi inatengeza kusoko, kwa sababu ile kiti ni moja. So we are seeking to have facility improvement fund ring fenced in Tharaka Nithi County, kwamba ile pesa yote itakuwa kwa hospitali iingie kwa kiti ya hospitali, na hizo pesa zitarudi hospitali. Kama kuna kuongeza pesa ya hospitali itaongeza kwa barabara, lakini pesa ya barabara inaweza ongeza ya hospitali. That way we will be able to make sure that we have more money to employ more doctors and also other cadres. And it's something we are asking all the other counties to be able to do. Make facility improvement fund function ya mwisho, Madam CS, ili kupatia nafasi usalimie our staff na wananchi wetu.
Thank you very much, Your Excellency Governor Muthomi, the hospital management team, the county administrator and the security team that is here, na wananchi wa hapa Marimanti. You said Mugani? Mko wazima? Hata kama tuko hospitali najua kuna wale wako wazima. Asante sana, Your Excellency. I want to take this opportunity to thank you most sincerely for opening your door that I come and see what is happening. Because, it is so easy for me to sit in Nairobi as the Minister for Health and not know what is happening on the ground. And I'm happy that you have opened your door, that leo tumekuja hapa Marimanti, and we have observed several things, which one, I want to congratulate you together with your hospital management, because this facility, from the way you have prepared the flow of the patients up to the end, it shows a very coordinated team and a very clean hospital. So congratulations. I also want to thank you because we have had a lot of issues around this managed equipment services. And when I'm speaking to the media, I don't like calling it mess, because that connotation has gone very badly and many people think it's a very bad thing. It's a managed equipment system. And I have been able to see that it is supporting this hospital. I think we've been to the X-ray, we've seen the equipment there. We have been to theater, we have also seen the equipment there. And your people have confirmed to me that those equipment are in working condition. And they have also said to the people manning that they have been trained on use of those equipment. Therefore, Your Excellency, as you sit as a chair of Health Committee in COG, mine is that you work together and you get to inform your fellow governors so that we make good use of this equipment while it is with us. We ensure that we have a short downtime. Whenever there's a problem, that the equipment are quickly fixed and they are able to work for the people. I also want to congratulate you together with your team with the partnership that we have seen with the Google services. We've seen on first hand how a patient from a very remote facility is able to be taken care of by a clinician sitting here. And in the same breath, we have also seen how a clinician here is able to manage a patient with support from a medical officer from Chuka, which I believe is the way to go. And His Excellency, the President, in his manifesto, the plan, we are leveraging on ICT. And therefore, you have already demonstrated. Google has said that you have been on the piloting phase, which you are finishing, and now they are hand-holding you to ensure that the project moves faster. So Google, once this goes well, we should have a conversation. I have already talked to Dr. Mulwa here, that then we can have a sit-in with Google, with the Ministry of ICT. We sit together and we see then how do we move this kind of facility to other counties so that it is able to be used. So I think that is a good thing that we need to move with. Your Excellency Governor, mimi nimepewa kazi na rais ya kumanage afya na amesema tunataka to achieve universal health coverage. Ili hao wananchi wakienda hospitali anywhere wanatibiwa bila kutoa pesa wapi? Kwa mfuko. Na hiyo ndio kazi mimi nafanya. Hata nikija hapa leo nikutembea nione ni wapi tunaweza shirikiana ili hao wananchi wapate hiyo manufaa. And we are already working on it. Miezi michache inayokuja tunatarajia kwamba kuanzia mwezi wa 7 hapo hivi tutaweza kurecruit wananchi wote wawe katika NHIF na muweze kuaccess matibabu bila kutoa pesa kwa mfuko wenu. Si hiyo rais amefanya jambo mzuri? Kwa hivyo tukiroll out hiyo simtafurahia. Na nataka kuwashukuru nyinyi kwa kumchagua huyu governor. Yeye ndio chair wa kamati ya afya. Na mimi na yeye tunafanya kazi kwa pamoja. Ndio kwa maana akaniambia nikuje nianzie hapa nione ground iko namna gani. Nisikae kwa ofisi na ground ni mbaya. So we have seen where we need to work together, and I promise you, Governor, we are going to work together very well. On the issue of health workers, it is a serious issue. We are taking it very seriously. We have seen that there is a deficiency, like the whole of this country. I think I was being told in the morning that we need to have about 50 doctors, yet we only have 6 and working, and 14 are on study leave. So we need to have honest conversations. And here I want to speak to our doctors, our professionals through their professional bodies, that let us sit down and have a conversation regarding how we manage health workers. It is a high time. I already spoke to my Director General that we do an inventory of healthcare workers so that we get to know who is where, who is on study leave, and therefore how do we fill in the gap to ensure that patients are taken care of. So we are taking this very seriously, and we are going to work with you, Your Excellency, that we bring all the people on board. KMPDU, they need to be with us. The Clinical Officers Association, the Nurses Association, the Lab Association, Biomedical Association, all cadres, even the nutritionists, we bring them on board, we take an inventory, we fill the gap, na ndio tuweze kuhudumia wananchi vizuri.